Hello, everyone, and welcome to our outreach project presentation. We are focusing on the population of people struggling with eating disorders. So we're just going to start off with a few facts. So these are all facts from the Emily Program Foundation. So you can see that 1 out of every 5 women struggle with an eating disorder. Eating disorder affects 30 million Americans. Bullying about your body size and appearance is the most common form of bullying in schools for both girls and boys. And finally, eating disorders are a mental illness and not a choice.
So, eating disorders is not very commonly talked about in our society, but it seems like now it's becoming something that society is looking into a lot more. In fact, there are about an estimated 11 million Americans, mostly young women, who suffer from eating disorders. It's something of a silent epidemic, they say. It's something that's kind of been undercover, and a lot of people don't talk about it. So, two of the most serious eating disorders that are well known or common are anorexia nervosa and bulimia nervosa. So anorexia nervosa is a condition in which people kind of starve themselves, and it has the highest fatality rate of any psychiatric disorder. And bulimia nervosa is a condition in which a person engages in some sort of like binge eating, and then afterwards they will voluntarily, forcefully throw up or purge, as they say.
So, because we're focusing on the eating disorder population, we kind of wanted to give an overview of common eating disorders. So first we're going to talk about anorexia nervosa, which Marianne kind of talked about already. But it is a disorder that twists your perceptions. So it convinces people to see themselves as overweight, even if they are starved or malnourished. According to the National Eating Disorder Association, some warning signs of anorexia nervosa are dramatic weight loss, dressing in layers to hide weight loss, and they become preoccupied with food, weight, calories, or you can hear them making frequent comments about feeling fat. Another eating disorder is bulimia nervosa. So that is a repeated cycle that involves eating unusually large amounts of food, followed by purging or self-induced vomiting, fasting, laxative abuse, or excessive exercise. Some symptoms and signs that are reported by the National Eating Disorder Association include appearing uncomfortable eating around others. They develop food rituals. They skip meals, sometimes have difficulties concentrating or problems sleeping. Another couple eating disorders that we see are compulsive overeating, which would be when people eat excessive amounts of food, but not necessarily because they're hungry, but to feel better or even to feel happy. And then another one is binge eating disorders, which is when an individual repeatedly and uncontrollably consumes extreme amounts of food that often results in obesity. So you've heard us talk about the Emily Program Foundation quite a few times in our presentation, and so we wanted to kind of cover what the Emily Program Foundation is and why we've been talking about them so much. So the Emily Foundation is a program that supports eating disorder awareness. They provide treatment and lifetime recovery for a passion for what they do, integrity for how they do it, respect for who they serve, and the service delivered in a way that works best for the clients. So they focus on treatment that's focused on the individual using evidence-based treatment. So an article that we found was an article written by Kim L. Grinchick. They titled Enduring Perfectionism, Seeing Through Eating Disorder Recovery and America's Cultural Complex. So, this article talks about how treating eating disorders with a problem solving perspective is not always the most effective because it can, and I quote, perpetuate perfectionism through unrelenting optimism. So, the article goes on to talk about how food has always been an important human relationship ever since the earliest of times. And the article challenges the current mode of treatment of eating disorders and encourages counselors to be able to open up the imagination in order to see through suffering. So, the next article is titled Excessive Time Spent on Social Networking Sites and Disordered Eating Behaviors Among Undergraduate Students. So, this article consisted of a sample of 383 undergraduate students, which was 72.2% female. And the data was collected through a self-reported questionnaire that asked questions related to social networking, site engagement, body image, disordered eating behaviors, and then some demographic questions as well. And it focuses on the connection of time spent on social networking sites and disordered eating behaviors, and specifically, the work examined if body image concerns mediate the relationship between excessive time spent on social media sites and disordered eating behaviors. So the results showed that lower weight and appearance esteem mediated the relationship between excessive time on social networking sites and restrained eating for males and females, while appearance esteem mediated the relationship between excessive time on social networking sites and emotional eating for females only. So this article really focuses on how our society works and how important social networking sites have become and how much of an impact that they actually can have.
So our next article is by Hurst, Wallace, and Reed on Munsley Family-Based Treatment, or MFBT. MFBT is referenced by the American Psychiatric Association as the evidence-based treatment for eating disorders, specifically anorexia. So MFBT is most beneficial for children and adolescents. And since eating disorders affect a large amount of adolescents and kind of seem to have an onset at that time, this treatment is useful to explore. So MFBT focuses on the family unit. So the family is active in the treatment of the individual with the eating disorder. And it's usually done over 20 to 24 sessions over a year and is separated into 3 different phases. So the first phase is refeeding. So a lot of the time, especially with anorexia, patients need assistance in getting back to a healthy weight. And you can't really start the treatment until the individual is back to a healthy weight. So the refeeding involves like family meal times. So the counselor could assist with that and helping the family dynamic at mealtime. The second phase is encouragement. So the parents would encourage the individual to have a meal by themselves without supervision. So the client would kind of have that alone time in the kitchen and kind of report back after that. The third phase is establishment of autonomy. So this is only started after the individual has gotten back to a healthy weight. The next goal of treatment would to be help with independence, with eating, and just in life in general after treatment, because this treatment is done in a residential facility. So our program really does help focus on that third step, the autonomy.
So the types of eating disorder treatment facilities are outpatient eating disorder treatment. This type of treatment is the least restrictive level of care. Patients may see a nutritionist, therapist, or other recovery professional approximately 2 to 3 times per week. This level of care can be helpful to those who need to continue to work or attend school. The next facility is intensive outpatient eating disorder treatment. This level of treatment is designed for patients who need more support than outpatient treatment, but still have the flexibility to remain in school or work. Programs at this level usually meet at individualized times for the participant, ranging from 2 to 5 days a week. The next facility is residential eating disorder treatment. At this level of care, individuals are provided with 24-hour care at a live-in facility. Constant medical supervision is placed over every participant, which makes it effective in monitoring health conditions. These treatment programs are usually very structured, offering a type of setting that allows a patient to focus solely on physical and psychological healing. The next facility is inpatient hospital treatment, eating disorder treatment. This level of treatment offers a continuum of care 24 hours a day in a hospital setting. The primary focus of this level of care is medical stabilization and interruption of weight loss, with typical stays less than 3 weeks. And the last is continuing care. After discharge from residential or inpatient programs, patients have the option of continuing care. This would allow them to continue having periodic sessions with their primary therapist and nutritionist for ongoing support and recovery. And there are also eating disorder groups for support and empathy, and to also hold each other accountable. So the types of treatment that are used for eating disorders are cognitive behavior therapy, which is a form of psychotherapy that focuses on negative patterns of thinking as well as beliefs that contribute to those thought patterns. CPT, as it's called, teaches participants skills that allow them to identify problematic beliefs as well as healthy ways to cope with emotion. CPT can be used to decrease destructive behaviors, which may include educational components and the development of a meal plan, as well as addressing various facets such as family, psychological, or social factors. The next treatment plan is medical nutrition therapy. This is a holistic method of treatment with various medical conditions and their associated symptoms. This is achieved by the use of customized meal plans that are usually formulated by a registered dietitian. MNT, which as it is called, is used in the recovery of those who suffer from eating disorders to help establish normal eating behaviors and improve one's relationship with food and body. The next therapy is dialectical behavior therapy, DBT. It is a form of psychotherapy that connects cognitive and behavioral methods as an approach to coping with painful emotions. Although DBT was originally designed for those who suffer from borderline personality disorder, it can be beneficial for eating disorder treatment as well, as it allows the individuals to better deal with conflict and stress while gaining increased control over negative thoughts and emotions. The next therapy is acceptance and commitment therapy. Acceptance and commitment therapy is used to help patients concentrate on ways to become aware and accept their emotions and experiences. ACT can also help sufferers with eating disorders to recognize thoughts and urges that are tied to the illness, assisting them in understanding their impulses. Art therapy is the next therapy. This is a form of psychotherapy that uses art media as its main form of communication and therapeutic healing. Art therapy can be an important part of treatment for those who are suffering from eating disorders, as it allows a creative outlet for expressing and healing. Art therapy can also be useful for treating co-occurring disorders such as substance abuse or mood disorder. Dance movement therapy is a therapeutic form of healing that allows participants to become involved in an alternative way of coping and expressing emotion. In regards to eating disorders, dance therapy can be influential in healing through guided movements and expression. Equine therapy is a form of psychotherapy that uses horses as a tool for emotional growth. Patients who use equine therapy during treatment might have increased self-esteem and body image, particularly as the care for an animal has been shown to be an empowering experience. Exposure and response preventive therapy. Exposure and responsive preventive therapy is essential to help an individual overcome fears and anxiety. ERP, as it is called, can be effective in a treatment of eating disorder as it helps participants overcome fears of forbidden foods and decrease urges to binge or purge. And as Danielle about family therapy, it is an important part of treatment as this involves and works with families and couples. The goal of the therapy is to promote nurturing change and maturation, and sessions are overseen by a family therapist. Interpersonal therapy. Interpersonal therapy is a form of therapy that focuses on managing interpersonal problem areas such as unresolved grief, role disputes, role transitions, and interpersonal deficits. In the treatment of eating disorders, IPT has been shown to be beneficial in that it increases self-esteem and body image. IPT also is useful in addressing other disorders such as substance abuse and bipolar disorder. And finally, the Mosley method, which Danielle mentioned. The family-based treatment focuses on incorporating parents as an active role in their child's recovery process for eating disorders. This could include guiding parents in helping their child eat balanced, healthy meals and prevent use of eating disorder behaviors such as purging or overexercising. This method involves 3 stages, which Danielle talked about, that can be a crucial part of long-term recovery for adolescents with eating disorders. So recently there was a case that went before the Supreme Court in 2013, and what happened was a client at Castlewood Treatment Center was actually denied coverage, and she was denied coverage, and it was about $1,000 per day that she was racking up because she had been in the facility for approximately 8 months. So Blue Shield decided not to cover her. So with her not getting covered, her parents had to take out a loan on their house and they actually paid the bill. So she subsequently sued Blue Shield, and the court ruled that in her favor that she could actually recover the money. As of this day, they don't know how much money she has recovered, but the story illustrated the need for food preparation assistance outside of residential facilities.
Okay, so hearing all that information, we decided to create a psychoeducational approach to our outreach project. So we created a project called Chicken Soup for the Soul, and it basically kind of equips the clients struggling with eating disorders or other kind of co-occurring disorders with strategies to kind of enhance their self-care. So basically what we would do is that for every residential client, for every 2 weeks, we would offer a cooking class that they can come with, they can invite their friends and their family to. And using their friends and family, they can kind of learn how to create more sustainable, healthy, nutritional meals to basically, increase their self-care and enhance their self-care beyond the treatment center. So once they leave the treatment center, they have these resources, based on what they've learned in this class or these classes, to kind of use as their food in the days to come. So the class will kind of start with this time of reflection where we'll read a part of the book called Chicken Soup for the Soul. And it's basically, Chicken Soup for the Soul is a collection of short stories, and it kind of inspires hope, and it's very positive, it's very inspiring. And so after they read those short stories, we might read a couple, or maybe we might focus on one depending on who's facilitating. We'll have a small time of discussion where the clients and their friends and family can kind of share and talk about some of the thoughts they're having or some of the sentiments behind the stories that they've just heard, and they can kind of share. And it's a time to kind of strengthen bonds and relationships and build trust between each other, between the family members, yeah. Afterwards, we will have a chef come in and they'll demonstrate how to create a healthy meal for these clients and also for their family and friends. So it's a way for their family and friends to also be involved positively helping the client as they get better at learning how to say no to their disorder. Yeah, and so after they kind of have the chef demonstrate, the clients will participate in kind of creating the same dish with the help of their friends and family. So that's kind of basically the outline of what our project, Chicken Soup for the Soul, is all about.
So some objectives and goals for our program are based off of all the research methods we talked about, the treatment techniques, and just kind of our overall purpose of the program. So the first goal we have is to provide clients with independence in the kitchen. So as we mentioned, getting that autonomy and independence back is very important for individuals with eating disorders. We hope to give clients the tools and ability to create simple and healthy meals for themselves and their families, provide clients a positive and constructive outlet. So something kind of fun to do in the residential center, that they kind of have that time out to enjoy the time with their family and friends, to share motivational stories through Chicken Soup for the Soul book and through the exchange of personal experiences, to help the clients view food in a positive light. So a lot of the time with eating disorders, food is a fear, or kind of people are frightened of food. So it's kind of giving a different spin on that. Next, to engage clients with their families and peers. So since they are in this residential facility, they do have kind of a time away from therapy to spend with their family and friends. And then to promote clients to share these new meal skills with their families and friends. So they would be able to take this out of the center and practice this at home as well. So the treatment of eating disorders is complex, and it often involves other family members, as we have talked about in the previous slides. So that is what we base this program off of. It meets the needs of the population, as we described in the beginning, and is aligned with the current research treatments of eating disorders. And there is room in our program for family involvement if desired. So we kind of try to encompass the whole area of recovery there.
So in conclusion, we've heard so much about eating disorders. It is definitely a silent epidemic, as we mentioned earlier. It's something that's kind of wasting or eating away at the core of our youth today. And so our project is kind of a way to incorporate a more family-based therapy kind of approach and utilize their family, utilize the support system to redefine a potential trigger for them. In the case of eating disorders, a trigger could be just food. And so we're kind of just recreating that by kind of engaging in something fun and with the family involved. And so we hope to also, through this program, be able to strengthen bonds between family members and just create a more positive experience for our clients. So yeah, that's the end of our project. And I hope that we all hope that you enjoyed hearing about our outreach project, Chicken Soup for the Soul.